Good day, everybody. My name is Dr. David Amron. This is Lippy Logic at the Lippy Lounge. Today's topic is about respecting the skin and a smooth result. So a lot of the work that I've done over the years with liposuction is revision liposuction surgery. And I talk about the different categories of revision liposuction surgery. And a big category when things are creating problems is irregularities of the skin. How that surgeon has dealt with the skin. I can look at a patient and understand what is causing their particular problem because of the way in which the surgeon has done things. And many times it is the disrespect of the skin that's created those problems. We're going to talk about this. We've also talked about the concept of the safe plane. Staying in that safe plane with liposculpture surgery. It's very important, part of the whole technique that I have. So you're not getting into deeper tissue, causing problems, and I call that the bad stuff, getting down below that safe plane into things underneath the layer of fat, which is muscle or other tissues where bad things can happen, but also staying parallel to the skin surface, always while you're liposuctioning. You're using straight cannulas. Let me see if I can grab one over here carefully. You're using straight cannulas that really don't flex and bend. And you don't want to flex and bend them, and you want to stay in that plane with your cannula all the time, whatever you're using to be sculpting. If you're poking the skin from underneath, that's caused a lot of problems and irregularities with things. So many things can occur with it. The skin's going to respond unevenly in terms of how it retracts, because if the surgeon is poking that skin from underneath, they're irritating what's called the dermis. The dermis is the deeper part of the skin itself. The dermis is made up of connective tissue. It's made up of collagen and elastic fibers that contracts. And the surgeon always should be parallel to that skin surface, whatever they're using, so they're not getting uneven retraction of that skin and unevenly irritating that dermis and getting scarring of the dermis there. So I don't know if I'm making this is clear to you, but staying in that precise plane is very important. And if a surgeon disrespects the skin from underneath, you're going to get irregularities with things going on. The thicker the skin, the more taut the skin is, the more forgiving it is. So areas like the back, or if the skin is very taut, areas like the calf and ankle area, the surgeon can maybe even be careless and just be in there, and the skin will still tend to pull back evenly because you're dealing with very taut, thick skin. In other areas that have thinner skin or are less elastic, they're more prone to irregularities. The inner thigh skin. The inner thigh skin is very thin skin. It's almost the thinnest skin in the body besides the eyelid skin. The abdomen, especially if a woman has had children, the surgeon has to be very, very careful in his approach to that skin because otherwise it will pull back unevenly with things. With lipedema, it makes it that much more complicated for two reasons. Number one is lipedema patients tend to have thinner skin. It goes along with the hyperflexibility of their joints in a condition called Ehlers-Danlos, where their skin has more of a movable quality to it. So again, we're back to skin that's less elastic. It needs to be more skillfully approached from underneath to not get irregularities. You're dealing with more cellulitic changes. That's another topic we're going to talk about later, cellulite and lipedema. You're dealing with more fibrosis in lipedema patients. And the understanding of how to deal with that fibrosis, how to release that fibrosis completely and evenly. All these things play into getting a smooth result with any type of liposuction surgery. The technique that I use pays a lot of attention to that. It's all about keeping that safe plane, preparation of tissue, parallel to skin surface, where incision points are placed, counter retraction, myself and the tech making that sheet, that skin a tight sheet, and then sculpting, not having everything just move around, the surgeon just being there jabbing at things. Where your incision points are placed strategically in natural skin tension lines of the skin, using other devices like Vaser. I've talked about this. I like Vaser a lot in lipedema because it releases fibrosis even more so, especially the granular fibrosis under the skin, and prepares the skin for a smooth result with things. And then finally, like I mentioned, with reduced elasticity of the skin, you want to be more conservative with how much tightening you're getting. Even though I'm using things like J-plasma for attraction of the skin, I'm very cognizant if you over-attract that skin and that skin is not going to support that degree of contraction that you're going after, you're going to increase your chance of irregularities with things. So liposuction surgery should achieve the best functional results and disease treatment and prevention, and the best cosmetic results also. And a big part of that is how the skin is dealt with. I'm Dr. David Amron, Lippy Logic at the Lippy Lounge. Thank you so much for tuning in.